Hello, I'm Dr. Pflug and I'll be explaining the subluxation. If you've been to a chiropractor before or if you've heard me talk about it, you might be familiar with the concept. I'm going to use this form as a guide. This is a form that I send home with my new patients. It's called What is a Subluxation and is created by Corn Publications Incorporated. What I find most interesting about the subluxation is that the chiropractic profession is actually the only one to acknowledge it. We're the only ones to treat it, and this is actually what we're looking for during our chiropractic/spinal examination. We're looking for joint misalignment, we're looking for muscle tension, we're looking for increased temperature, we're looking for swelling of tissues surrounding the joint, and we're looking for pain. Here we go. Here we have the first component of subluxation, which is joint damage. This is in regards to synovial joints, which are freely movable and under voluntary control. The key phrase here being freely movable, because once a joint loses freedom of full range of motion, bad things start to happen. As you can see, we call it a locked or a fixated joint, or a joint starts to click because it's damaged. There's no question about it. And it's basically due to that loss of range of motion. Now we start to see loss of energy and we start to see increased fatigue on an overall scale because of that loss of motion. And here we have the next component of subluxation, which is nerve damage. Now we're starting to get into the good stuff, because me personally as a chiropractor, the nervous system is what I'm most interested in. And within a subluxation, there could possibly be compressed nerves, some stretching of a nerve, or even pinching. Now, all of these are causing an interference to optimal nervous flow. And it's this interference that's really causing all the problems to our nervous system. We start to see nerves function abnormally. And remember, nerves carry many things, but mainly they carry sensation or motor capability, right? Movement. So if we start noticing issues with our sensation or our motor control, oftentimes a subluxation could be to blame. Also, we see altered organ function. So if a segment of the spine is subluxated and a nerve just so happens to be going to, any particular organ right at that point of subluxation, we could see some altered organ function. Also, pain is very common. That's another thing that nerves carry that's within the realm of sensation, is pain. And then also we could see some cognitive effects as well, as you see described in that last bullet. And next we have the third component of subluxation, which is tissue damage. Within this idea of tissue damage, we have a lot going on actually. We have hard tissue, which is bone, and we have soft tissue, which is muscles, tendons, ligaments, joint capsules, and discs. And each of these are made up of cells. Actually, if you look at the description, you see in parentheses histopathology. That's the study of cellular disease. And when I say tissue damage, I'm referring to tissue damage on a cellular level. Let's take muscle, for example. Normally, muscles are long and strong. However, what happens with life and bad posture is we get into trouble with our muscles because they become short and weak. In fact, there are usually many, many muscles surrounding a joint or going through a joint, crossing a joint we call it. And it only takes one to be short and weak to mess up the whole biomechanics of that specific joint and then joints around or other joints throughout the body. And if your body is forced to deal with an asymmetry and balance of your musculature through the means of a subluxation, you're asking for trouble later in life, because arthritic changes and other degenerative changes come from prolonged misalignment. They come from prolonged abnormal muscle tension. Which brings us right into the fourth component of subluxation, which is muscle damage. I mentioned before that these muscles are short and tight, which basically means they're weakened, chronically tense, as you can see in the description, associated with muscle spasms and pain, and then on a broader scale, postural distortion, which is probably what the average person notices first and most. And as chiropractors, we're looking at gross imbalances as well, symmetry, just body symmetry in general. But what we really specialize in is the ability to distinguish on a very small scale which muscles are tight, tense, weak, and painful, and then also other tissues that might be involved. And lastly, we have our fifth component of the subluxation, which is health degeneration in general. Chiropractors deal in this gray area. We deal in this gray area between normal and disease. A lot of healthcare providers usually won't intervene on a patient until they're at the diseased level or some sort of pre-disease threshold, but that threshold is usually very high, and most of the time chiropractors pick up on this dis-ease. You see that dis-ease, not disease, but we pick up on this dis-ease state of the patient. So it's this gray area between normal and disease. Also, we have accelerated aging. This is just the definition of degeneration. So it's the accelerated aging of tissues at a faster rate than the rest of the body. We also have chronic fatigue as a consequence to the existence of a subluxation. We have lessened ability to respond to physical and emotional stress. Goes right into chronic fatigue. You don't have the energy to deal with this stuff. You don't want to deal with this stuff because your body's working so hard to overcome this interference to its nervous system, to its master control system. Also, we have lowered resistance to disease because our body actually has this innate intelligence that resists disease. Now, when our innate intelligence is not functioning well, when it's being interfered with by this nervous interference, we lose that resistance to disease. And then we start to have more joint degeneration. You start to see bone deformation, like in degenerative disc disease. Several segments of the spine become deformed with osteophyte, which means bone spurs, and then also the disc it says disc destruction, but really the disc desiccates. It's not getting that hydraulic pump anymore. It's not a big juicy disc that actually lets the vertebrates sit comfortably on top of each other. Instead, it's desiccated. It's dried out. There's not much left of it. So it loses that disc height, and then it also loses your body loses the ability to really hold on to an adjustment. The body craves adjustments because all an adjustment is just restoring or encouraging normal motion. That's all it is. The body loves normal motion. The body thrives off normal motion. But there is a point at which your body stops holding adjustments for very long. And that's what this is really trying to get to. Okay, so now we know exactly what a subluxation is, and I appreciate you watching. Please let me know if you have any questions. Thanks a lot. Have a nice day.